So now we're going to talk a little bit about epidemiology. Epidemiology is the study of diseases in populations. Oftentimes, epidemiologists will look at statistical evidence that demonstrates how diseases are transmitted in populations and in groups at risk. Different types of epidemiology studies involve occurrences of infections in different parts of the world. So here we'll define some of those. Endemic. Endemic means that a disease is confined to a particular geographical region. So, for example, malaria. Malaria is endemic to tropical climates. So malaria is not endemic to the state of Wisconsin. Epidemic. Epidemic is an outbreak of numerous cases of a disease in multiple locations. Sporadic means that you have a few cases of a disease in multiple locations. And pandemic is when you have cases of an infectious disease on multiple continents. So pan is talking about global or worldwide. So pandemic means that this disease is now found on multiple continents. The attack rate is the number of people that become ill after exposure to an infectious agent. If we have someone come into our classroom with the flu and one new person gets sick after we've all been exposed, then it has an attack rate of 1. The higher the attack rate, the more dangerous that pathogen is. Incidence is the number of new cases in a specific time period. So if we say there's 13 million new cases of STDs in the United States each year, the incidence would be 13 million per year. Prevalence is the total number of cases in a population at any time. If we say that today 100 million people currently have STDs, then that's our prevalence. Morbidity is the incidence of disease in a population at risk. So if we go back to the classroom scenario, we're all at risk of having the flu because we're all in an environment where the flu exists. If only one of us has the flu, then that's our morbidity. It's the incidence of disease in the population at risk. Mortality is the overall death rate in a population, and that mortality rate is attributed to that infectious disease. There are a couple agencies that monitor epidemiology. So the Centers for Disease Control and Prevention, the CDC, which has their headquarters in Atlanta, Georgia. They mainly focus on the United States, and they want to make sure that infectious diseases are not coming into the United States. And then there's the World Health Organization, the WHO, which is an agency of the United Nations, 193 member states, including the United States. And they kind of monitor the global progression of diseases, and they try to make sure that they're attempting to prevent the spread of diseases around the world. So they want to avoid pandemics. The CDC has issued biosafety levels for handling infectious agents and working with these types of infectious agents in hospitals and educational facilities and research facilities. Our classroom operates at a biosafety level 1, so BSL 1. So we use a standard open bench. There's no special facilities that are needed. Typically, or it's typical of most microbiology teaching labs. Access may be restricted. You don't want to have food or drinks in the lab. BSL 2, that's what most hospital labs work at. So at least level 1 facilities and practices plus personnel must be trained in handling pathogens. Lab coats and gloves are required. Safety cabinets may be needed. Biohazard signs posted. Access is definitely restricted. So in a hospital lab, you can't just walk in off the street and go into the active culturing area. A BSL 3 involves agents that can cause severe or lethal diseases, especially when inhaled. So these include like tuberculosis, Francisella, the plague, brucella, coccidioides, which is a fungal agent, yellow fever, HIV. Those types of facilities are usually like the state labs of hygiene, If an infectious disease is diagnosed in a hospital that merits a BSL-3 handling, then it is sent to the BSL-3 facility. And then BSL-4 is highly restricted. There's very few BSL-4 facilities in the nation. These are designed for the research of infectious agents that have the potential to kill a very large number of people. So agents are highly virulent microbes that pose extreme risk for morbidity and mortality when inhaled in droplet or aerosol form. So these we don't have a cure for, and they're extremely dangerous. So that's what's studied in the BSL-4.